The Pericardium Channel of Han Jueyin. 的灵数经脉 says the pericardium channel of Han Jueyin originates from the chest. Going out, it enters the pericardium, then goes down through the diaphragm to the abdomen, connecting with the upper, middle, and lower jiao. A branch rising from the chest runs inside the chest, emerges from the costal region, 3 cun below the anterior axillary crease, and ascends to the axilla. Follows along the medial aspect of the upper arm, runs downward between the lung and heart channel to the cubital fossa, continues down the middle of the arm to the tip of the middle finger. Another branch comes out of PC8 and runs along the ring finger to its tip. It connects with the pericardium, Sanjay, and diaphragm. In the miraculous pivot, the Ling Shu Jing Mai, the diseases that stem from the pericardium channel of Han Jueyin are heat in the palms, hypertonicity of the elbow and arm, axillary swelling, fullness of the chest and hypochondriac region, palpitations, red face, yellow sclera, and incessant laughing. The diseases of the pericardium channel of Han Jueyin relate to the vessel and manifest as restlessness, cardiac pain, and heat in the palms. Pericardium 1. 天池 on the chest, in the 4th intercostal space, 1 cun lateral to the nipple, 5 cun lateral to the anterior midline. Oppression of the chest, hypochondriac pain, axillary swelling, and pain. Needle obliquely or transversely, 0.5 to 0.8 cun. Pericardium 2. On the medial side of the arm, 2 cun below the anterior end of the axillary fold, between the long and short heads of the biceps brachii. For cardiac pain, hypochondriac distension, cough, and pain along the medial aspect of the arm. Needle perpendicularly, 0.5 to 8 cun. Pericardium 3. 出子, the He point. At the midpoint of the cubital crease on the ulnar side of the tendon of the biceps brachii muscle. Heart and chest diseases, spleen and stomach diseases, dry mouth, vomiting blood, diseases along the channel pathway, urticaria, heat, excessive thirst. Needle perpendicularly, 0.8 to 1 cun. Pericardium 4. Shimen, the Shi cleft point. On the palmar side of the forearm, in a line connecting pericardium 3 and pericardium 7, 5 cun above the transverse crease of the wrist. So this is a Shi cleft point on the yin channel, which means bleeding will be involved. We have heart and mental diseases because it's pericardium Shi, and coughing up blood, nosebleed, vomiting blood, vexing heat in the 5 zang. Disease along the channel pathway, elbow and arm pain, as well as furuncles and stomach aches. 0.5 to 1 cun. Pericardium 5. Jianshi, the Jing River point. On the palmar side of the forearm, on a line connecting pericardium 3 and 7, 3 cun along the crease of the wrist, between the tendons of the palmaris longus and flexor carpus radialis. Chest stuff, mental stuff, arm stuff, malaria stuff, plum pit sensation, loss of voice. Needle perpendicularly 0.5 to 1 cun. Pericardium 6, 内关, the lower connecting point and confluent point of the yin wei. On the palmar side of the forearm, on a line connecting pericardium 3 and 7, 2 cun above the crease of the wrist, between the tendon of the palmaris longus and flexor carpi radialis. Mental stuff, gut stuff, nausea and pregnancy, chest stuff, disease of the channel pathway, menstrual dysmenorrhea, irregular menstruation, usually connected or combined with spleen 4. Needle perpendicularly 0.5 to 1 cun. Daling, the Yuan source point and Shoestream Point, at the midpoint of the crease of the wrist between the tendons of the palmaris longus and flexor carpi radialis. Mental stuff, gut stuff, heart stuff, head and face and 5 sense organs, dry throat, foul breath. It's a great point for clearing away heat. Needle perpendicularly 0.3 to 0.5 cun. This is a great alternative to Heart 7 if you don't want to add or drain too much from the heart itself. You can go in directly. Pericardium 8, 老公, the yin spring point. At the center of the palm between the second and third metacarpal bones, touching the tip of the middle finger to the palm when a loose fist is made. Heart and chest diseases, mental disorders. Really, this is just a great place that heat vents off. 4 gates is generally known as liver 3 and large intestine 4, but in some classical texts, Lao Gong is also considered one of the 4 gates. It basically means just venting off qi or moving qi to the 4 directions. Those are the 4 gates, the 4 limbs. So you can, in Qigong exercises as well, you send out qi through Lao Gong, either to the first 2 fingers or otherwise. It's a great place to vent out heat. So if there's too much heat causing manic depressive psychosis, this is the point to do it. Dark urine, blood in the stool, again, lots of heat. This is a great point for letting out heat. Pericardium 9, Zhongchong, the Jingwell point, at the center of the tip of the middle finger. Heart and chest diseases, mental disorders, disease all in the channel, pus and blood in the stool, vomiting blood. Needle shallowly 0.1 cun or prick to bleed with a 3-edged needle. Moxibustion is applicable. I did this on a patient once. It had no effect and the patient didn't come back. Not my favorite point. I like some of the other ones a little better. The Sanjay channel of hand Xiaoyang. The Lingshu Jingmai states, the Sanjiao channel of the hand Xiaoyang starts from the tip of the ring finger. Remember, that's where the branch of the pericardium channel ends there. So now it's looping back. Runs upward between the 4th and 5th metacarpal bones along the lateral aspect of the forearm between the radius and ulna, passing through the olecranon process and along the lateral aspect of the upper arm. It reaches the shoulder region where it goes and passes behind the gallbladder channel of foot Xiaoyang, winding over into the supraclavicular fossa, into the chest, connecting to the pericardium, descending through the diaphragm and abdomen to go to the upper, middle, and lower jiao. A branch starts in the chest, goes upward through the supraclavicular fossa, ascends to the neck, runs along the border posterior to the ear, posterior border of the ear, on the corner of the anterior hairline. Then it turns downward to the cheek and terminates at the infraorbital region. Another branch arises from behind the ear and enters the ear. It emerges in the front of the ear and crosses previous branch at the cheek and reaches the outer canthus. Connects to the sanjiao and pericardium. It goes through the ear and eye. Manifestation examples. So we know where the channel is. Here's what could go wrong with it and what it might connect to. The Lingshu Jingmai states, the diseases that stem from the Sanjiao channel of Han Xiaoyang, so these are examples, are deafness. Why? Connects to the ear. Swelling of the pharynx. And sore throat. Diseases of the Sanjiao channel of Han Xiaoyang relate to the qi and manifest as pain in the outer canthus, swollen cheek, pain in the retroauricle region, shoulder, upper arm, elbow, forearm, pain and loss of use of the fourth finger. Sanjiao 1. Guanchong, the Jingwell point. On the ulnar side of the fourth finger, point 1 sun posterior to the corner of the nail. Externally contracted diseases, wind, for instance, head, face, and 5 sense organs, diseases along the channel pathway, poor appetite. Needle transversely, point 1 sun, or prick to bleed. Yemen, the Ying spring point, on the dorsum of the hand between the 4th and 5th fingers at the junction of the red and white skin, proximal to the margin of the web. Same indications. It's a little more for sore throat and removing heat from the channel because it's a Ying spring point. Zhongzhu, the Shoestream Point, on the dorsum of the hand proximal to the 4th metacarpal phalangeal joint in the depression between the 4th and 5th metacarpal bones. Tinnitus is different in this, otherwise it's the same as the last two. Also used for intercostal neuralgia. Needle perpendicularly, 0.3 to 0.5 cun. Sanjiao 4. Yangchi, the Yuan source point. On the dorsal transverse crease of the wrist in the depression between the ulnar side of the tendon of extensor digitorum. Dizziness, tinnitus, deafness, channel pain. It's the Yuan source point, so if there's deficiency in the channel causing pain anywhere, then you could give it a boost with this. Perpendicular insertion, 0.3 to 0.5 cun. Sanjiao 5. Wai Guan, the lower connecting point and confluent point of the Yang Wei. On the dorsal side of the arm, on a line connecting Sanjiao 4 and the tip of the allocarinin, 2 cun proximal to the dorsal crease of the wrist, between the radius and ulna. Diseases of the Yang Wei. Disease along the channel pathway of the Yang Wei. Head, face, ear, eye, deafness, tinnitus. Diseases along the channel pathway of the Sanjiao channel as well. There's a lot of overlap there anyway. Externally contracted diseases, febrile diseases, mumps. Perpendicular insertion, 0.5 to 1 cun. Zhigou, the Jing River point, Sanjiao 6. On the dorsal side of the arm, on the line connecting Sanjiao 4 and the tip of the olecranon. 3 cun proximal to the dorsal crease of the wrist. All of the same indications. The big one with this one is actually constipation. Very useful for constipation. It's used a lot in many classical texts and point prescriptions that will use this for constipation. Because it's not a large intestine point, you're pretty much guaranteed to find that as a test question. Needle perpendicularly, 0.5 to 1 cun. Sanjiao 7. Huizong, the Shi cleft point. This is a Shi cleft point, but it's on the Yang channel. So we're looking at pain, fullness in the chest, arm pain, at least sudden pain, acute pain. 0.5 to 1 cun. Moxa is applicable. Sanjiao 8. Sanyang Lo. On the dorsal side of the forearm, 4 cun proximal to the dorsal crease of the wrist, betwixt the radius and ulna. Deafness, sudden loss of voice, toothache, hypochondriac pain, arm pain. Weird. That's just indications of the channel itself. I think this is a loser point. Pretty much never use this one, but yeah, it's a point. And if that's where the channel is blocked, then use it. And it's good for all things that the channel is good for. It's kind of how acupuncture works as well. It's tedious to go through all of these indications. I'm doing it, I don't know, is it tradition? But just remember, it's more to do just with the channel pathway and where you are on that pathway. Sanjiao 9. 四毒. On the dorsal side of the forearm, on a line connecting Sanjiao 4 and the tip of the olecranon, 5 cun distal to the tip of the olecranon, between the radius and ulna. Deafness, toothache, sudden loss of voice, forearm pain. Perpendicular insertion, 0.5 to 1 cun. Tianjin. The He point. On the lateral side of the upper arm in the depression 1 cun directly above the tip of the olecranon when the elbow is flexed. Goiter, scrofula. Otherwise, same thing, channel diseases. Perpendicular insertion, 0.5 to 1 cun. Sanjiao 11. Qinglang Yuan. When the elbow is flexed on the lateral side of the upper arm, 2 cun above the tip of the olecranon and 1 cun above Sanjiao 10. Shoulder and arm pain, inability to raise the arm, migraine. Channel stuff, 0.5 to 1 cun. Sanjiao 12. Shaoluo. On the lateral side of the upper arm, at the midpoint of the line connecting Sanjiao 11 and 13. Headache, stiffness, pain in the arm, pain in the neck, inability to raise the arm. Sanjiao 13. Nao Hui. On the lateral side of the upper arm, on a line connecting the tip of the olecranon and Sanjiao 14. Sanjiao 14, 3 cun below Sanjiao 14, on the posterior border of the delt. This is for qi goiter, aching pain in the shoulder and arm. Perpendicular insertion, 0.8 to 1.2 cun. Sanjiao 14. Hey, that's got to be 3 cun up, right? On the shoulder, posterior to Li 15 in the depression, inferior and posterior to acromion when abducting the arm. Shoulder and arm pain? Yeah, just arm pain. Shoulder pain. Really useful point. Needle perpendicularly 0.8 to 1.2 cun. Sanjiao 15. Tianliao. On the scapula, at the midpoint between gallbladder 21 and small intestine 13, SI 13 and gallbladder 21, at the superior angle of the scapula. Shoulder and neck pain. 0.5 to 8 cun. Sanjiao 16. Tianyou. On the lateral side of the neck, directly below the mastoid process, on the posterior border of the sternocleidomastoid muscle. Headache, stiffness, facial swelling, sudden deafness. I slapped a guy here while sparring, lightly, but connected the body. It was a very light tap. He went down. It was a knockout hit. I'm not saying to hit people here for knockouts, but in my experience, it works. I've done it twice. Then I stopped doing it because it's probably not good for people. 0.5 to 1 cun. Sanjiao 17. Yifeng. Posterior to the lobe of the ear, in the depression between the mastoid process and the angle of the mandible. Deafness. Local stuff. Clenched jaw, toothache, swollen cheek. Needle perpendicularly 0.8 to 1.2 cun. Sanjiao 18. Chimai. On the head at the center of the mastoid process and the junction of the middle third and lower third of a line connecting Sanjiao 20 and 17 along the curve of the helix of the ear. Headache, tinnitus, it's venting off heat, deafness, it's right by the ear, and infantile epilepsy. That was out of left field, wasn't it? Transverse insertion, 0.3 to 0.5 cun. Sanjiao 19. Lü Xi, on the head, at the junction of the upper third and middle third of the line connecting Sanjiao 20 and 17, along the curve of the helix of the ear. Same indications. Headache, tinnitus, deafness, ear pain, infantile epilepsy, 0.3 to 0.5 cun. Sanjiao 20, Jiao Sun, on the head, above the apex of the ear within the hairline. Tinnitus, redness, pain and swelling of the eyes, swollen gums, toothache, mumps. Sanjiao 21, Arman, on the face, anterior to the supratragic notch in the depression behind the posterior border of the condyloid process of the mandible after opening the mouth. Headache, tinnitus, infantile epilepsy. Pretty good for tinnitus, actually. You just need to use a long needle. In this one, it says, 0.5 to 1 cun, but I've seen people go pretty deep on this one. You're not supposed to do that. 0.5 to 1 cun, right. Sanjiao 22, He Liao, on the lateral side of the head, on the posterior margin of the hairline at the temple, anterior to the anterior border of the root of the ear auricle, and posterior, means behind, the superficial temporal artery. Migraine, tinnitus, clenched jaw, really good for migraine. Sanjiao 23, Sizhu Kong, on the face in the depression at the lateral end of the eyebrow. Head stuff, wind stuff, eye diseases, toothache, headache, and epilepsy. This concludes the Sanjiao channel of the hand, Xiaoyang.